My name's Sue Davis. I'm Senior Coordinator of Colwyn Connect for Learning Disabilities, and today's been all about bringing parent carers together and people with a learning disability to share their experiences. The medical students who have been visiting, their main goal is to listen to the stories of the parent carers and their experiences of how they feel when they're met by doctors and medical, and really for them to take on board the stories of communication, sort of learning about time and patience needed when people with a learning disability are visiting hospital.
My daughter's adopted. She was adopted at 4 months and she weighed about 7 pounds. And I was told that she would take time to catch up. But by 18 months she wasn't making any effort to crawl or talk. And I had been going regularly to the clinic. And I was then referred to a specialist in child development. And he said to me and my husband, "Don't you think it's the way you're treating her that's stopping her develop?" Now that, I think, is a very callous and uncaring way to speak to somebody who is doing their best with a child that's not developing as she should be. And that had me in tears. Even now I can feel tears coming in my eyes. So I think one of the main pieces of advice I would like to give to people in the medical profession is not to be so dogmatic in your statements and to just think that people do have feelings and not to say things that can actually make the situation worse for parents.
Yeah. The project's been running probably about 2 years now, and it came to an existence primarily from the report that was done by MENCAP, Death by Indifference, and it was about making sure that people with a learning disability were treated the same.
It horrifies me, I hate to say it in a meeting like this, but the mortality rate amongst learning disability has been a disgrace over the years because of the lack of care.
We actually had a consultation session with parent carers and people with a learning disability, how they wanted to deliver their stories. So it came about that we have the sessions in a friendly, welcoming environment where parent carers and our members are at ease so that they can pass on their views. And we've probably been running about 18 months now to 2 years, and we've held 6 to 7 sessions.
My name's Julia. I'm a 4th year medical student at Cardiff University, and at the moment I'm on my 2nd clinical placement rotation doing psychiatric medicine in North Wales, and we're currently based in Rhyl. Other than today and an hour lecture on learning disabilities, we haven't really had any other formal or informal teaching on learning disabilities or learning difficulties. And today was amazing, really. It was like an invaluable experience because listening to these carers and these people suffering with learning difficulties in an informal context where they're comfortable in their environment and are sort of disinhibited and don't worry about time constraints. It was just really good to hear their stories and hear what they thought were good communication skills and bad communication skills from doctors, and what they expect, how they expect doctors should react to them. And it was just nice to hear how they think we should be acting and what we should do to improve their experiences in the future.
When you meet a doctor, what do you prefer them to do? Can you remember what you've told us in the past?
I just like to talk to you more, because when you go into hospital, they find it strange.
The parent carers and our members, people with a learning disability, are really getting quite a valuable experience from this. They feel that they're listened to, that they are valued, and that their stories will, do make a difference.
I'm Carol Harrison. We've sat in on quite a few of the sessions with the medical students, and it's been quite an amazing experience actually, because quite a number of them have never had any experience or never met anyone with a learning disability. And we have talked amongst ourselves as parent carers and said, well, possibly this has been the problem with many of the GPs in the past. They don't know how to react to people with a learning disability. They don't know how to talk to their parents or their carers. They don't always sit and listen to what we're telling them.
I think doctors should have more training, and nurses should have better training for people like us.
The younger generation now seem more aware, and these sessions have been extremely helpful.
The major problems I think that they were concerned about were sort of almost a lack of respect or a lack of compassion from the doctors mainly. They said a lot of the doctors were sort of old school in their communication skills and weren't very compassionate or empathetic towards the situation. And a lot of the time they said when they went to consultations or if they were seeing a new doctor, the doctor hadn't looked at the notes and didn't know that the client had a learning disability, and it didn't start them off on a good foot really. And other things that they complained about or mentioned were that there wasn't a lot of effort put into talking to the patient themselves or even valuing the parent's opinion, because obviously the parent knows their child the best and they have a good inclination of what, you know, if they're ill or if something's happened, and the doctor would often dismiss this as an over-anxious parent, and they felt this was, well, disrespectful really. They should, that should be considered.
When she started school, I always thought there was something that wasn't quite right, and one day I got pulled into the school to see the school nurse, and she sat me down. She said, "I'm sorry to tell you, your daughter's retarded." And that was, I'm going now. And then I had to go away and tell my husband, and then wait for the appointment at the hospital.
Obviously this type of session is a different style of teaching than, say, reading an actual case study. So this has given us the medical students experience of actual emotions and feelings from the parent and carers, so that would actually have more of an, we would like it would have more of an impact on them when they're actually in the future talking to parent and carers and people with learning disabilities. So this style of session complements other training areas. Instead of just reading, it actually allows them to empathise with the parent and carer.
It was just wonderful to hear patient stories really. So I think sometimes you're sort of thrown into medicine and you've got so much to learn that you forget that these patients are people and they have these experiences and they're really emotional and upsetting for people, and it's really nice to hear stories and to hear both the good and the bad experiences they've had, because it's so much more emotive. It's inspirational. It makes you want to be a good doctor. It makes you want to be remembered by people like this for being a wonderful doctor and for helping them and making that difference. You don't want to be one of these old school doctors who doesn't listen and upsets them, and then these people are forever scarred by that experience. It's really emotive, and it just leaves a lasting impression really, more than reading something from a book or being lectured at.
We hope the medical students will take back how best to communicate with people with a learning disability, an understanding of that parent and carers are like partnership in their care. Obviously that they're all individual, but the parent carers are there to sort of pass on and help with their health problems, but to treat the person with as an individual and not to ignore them. I think the biggest thing that we come from some of our members is that not to be ignored, and that they should have the choices and opportunities in health as everybody else would have.
Any doctor that I've been to see with my daughter, I have to go through the process of explaining to them she does have learning disabilities and she probably won't understand what you have to say. And I feel as if I shouldn't have to say this, if it could just simply be on a note somewhere on the screen, just to let them know before she goes in that she does have these problems.
One of the things that I thought was really important that previously I might not have put such weight on was just checking the patient's notes before you see a patient, because in the back of our minds we've got so much to do, we're so busy all the time, but just spending that 30 seconds looking in the notes and seeing a little background about the patient might make all the difference to the patient, and greeting them and spending the time getting to know them makes all the difference, and I think that's of real importance to both the patient and the carer.
Get feedback. I mean, the students fill in an evaluation form at the end which records their feedback. I mean, they certainly learn how to start to think about communicating with people, and they take on board the stories, so that if they come across people with a learning disability in the hospital through their training, and eventually if they go on to be a GP, it's taken on board how to communicate, to give time and patience, and possibly to think out of the box and be a little bit more understanding to their needs.
I think even myself, before today, I might have thought that, if they don't understand, you should talk directly to the carer who knows more about the problem. But today has made me realise that even if they can't communicate, and even if they can't understand, they're still your primary concern. You should still talk to them. Like, obviously the carer can hear you talking to them and knows about the situation. But I think it's really important to make the client or the patient the centre of the consultation, and then gather as much information as possible from the parent or the carer, because obviously they know the most about the situation.
Dawn, I know that's the one thing that always comes across, is that you hate being ignored, don't you?
Yes, it is, yeah.
You would always want them to...
Yeah, be more kind, friendly, doctors.
She had radical breast surgery, Dawn did, a number of years ago. And I took her to the local GP when we lived in Dorset, because she had an abnormality in the one breast. It hung quite low. When I say low, it really did hang below her waist. And it got to a point where she could only lie on one side in bed with a pillow. So I took her to the GP, who was an elderly lady, and she said, well, I can't do anything. She said, you'll have to have some braziers made for her. Fortunately, she retired, and we had a young GP. And when Dawn got undressed, she said, my goodness me. She said, you or I would not tolerate this. This is a disgrace. Within a matter of weeks, we had an appointment to see a plastic surgeon. And we were sent into a private hospital. At that time, they were trying to cut lists, and she was actually sent very fast-tracked into a private hospital, and both her breasts were reduced. And then she went to the local Lodstock to have her stitches out. Now, at all times, she was treated with the greatest respect, weren't she?
Yeah.
And it just shows, down to one GP, that was uncooperative, and I hate to say it, very uncaring at that particular time. And it made such a difference to your life.
I think the benefits of these sessions, and certainly what comes out of it, and is no doubt, is communication. I mean, communication is the big sort of part of this, that if people are unable to talk or express their needs, that they have to look at different ways of communicating. And certainly some of the things that have been happening, certainly within person-centred planning services, we've spoken about information being taken into hospital in an easy, understandable way for people to understand what's important to the person with a learning disability when they're in hospital. So I think that's a really big point that's coming across about the communication, signage, easy read, listening, and giving time for people to understand what's happening to them in their health and health organisations.
Really, it's about treating somebody as you would like to be treated yourself, and I'm sure you know that, and it's really no different. But it is about that extra time, extra patience sort of with them, and thinking out of the box as well.
It just kind of showed you how you can make a really big difference if you are like trying to put the patient first and make them feel at ease and help the family. You can do so much good in that. So I think we all felt like it was quite inspirational actually. We were like this whole morning.
Well, that's good,
quite,
isn't it? Yeah, really. That's what we want to pass over to students, and you will carry that a lot of this stuff. For the rest
And
of your
you will
life.
find that
Whatever you do.
Yeah.